Every year, 22,000 women in the U.S. are projected to be diagnosed with ovarian cancer. Well, September is Ovarian Cancer Awareness Month, and joining us now with information on how to take charge of your ovarian cancer treatment is Dr. Robert Holloway, the Medical Director of the Gynecologic Oncology Program at the Florida Hospital Cancer Institute. Hi, Dr. Holloway. Thank you so much for being here.
Good morning, Sasha. Thanks for having me.
How many people are diagnosed with ovarian cancer in the United States?
Approximately 22,000 new cases a year. That number really kind of hides the fact, though, we have about 250,000 women in the United States living with ovarian cancer, living with that diagnosis. So it's a much bigger number that face the reality of possible recurrence of their cancer.
What are some challenges faced by doctors, patients, and their loved ones as they discuss ovarian cancer treatment options?
Well, aside from the obvious challenges of major surgery and chemotherapy, we do get the vast majority of our patients into a treatment response category that we call remission, meaning no evidence of disease on a CAT scan perhaps. And while we get those patients there, we're left with the unfortunate truth that the vast majority over their lifetime will suffer recurrence of disease, more treatment with more chemotherapy and more surgery. And until recently, we really haven't had many options to help maintain that remission. And that's the forefront of research now, and that's the news about ovarian cancer, where we're at with maintenance therapy.
What kind of treatment options do people have after chemotherapy?
Well, again, until recently, it's been watch and wait. And of course, as you can imagine, that creates a lot of anxiety for the physician as well as the patient about when is recurrence going to happen. But recently, through research of a new class of compounds called PARP inhibitors, the FDA has approved an oral, once-a-day treatment to help maintain remission in patients who's had their second treatment with a platinum-based therapy and achieved a response. This drug therapy can significantly prolong the remission, prevent recurrence of disease, and lower the death rate over time for patients who've shown a response to their second-line therapy. It's a once-a-day treatment. It's a pill. It doesn't require coming into the infusion center and being hooked up to an IV. It frees up patients to travel. It's a new paradigm in ovarian cancer treatment.
What is the BRCA gene, and why is it important for ovarian cancer patients?
The BRCA gene is important for a couple reasons. Number one, it's associated with breast and ovarian cancer, and it's an inherited gene. So about 17 to 18% of patients with advanced ovarian cancer actually inherited a gene from one of their parents that predisposed them to ovarian cancer. It's important that the patient know that so that they can inform their siblings, their children, their sisters about being tested for the BRCA gene.
Now, if patients and their loved ones want to get more information, where can they go?
I think the best information about Zejula is at Zejula.com. That's where you'll read all of the clinical trial information, FDA-approved information about safety, prescribing information, and then discuss that information with the treating oncologist to determine whether you could be a candidate for maintenance therapy with Zejula. For more information in general about ovarian cancer, I'd go to the Women's Cancer Foundation and Google that site and read about ovarian cancer as well as other gynecologic cancers, how you can prevent it or treat it.
Dr. Robert Holloway, thank you so much for bringing us this important information and for joining us today on Coffee with America.
Thank you very much for having me.